First of all, the vaccines were actually tested for both safety and efficacy given at that time. So we know how those vaccines behave when given all together at that very young age. In fact, we're very carefully tested in tens of thousands of patients. So we know that it's safe. Two, we know that all the vaccines work well when the vaccines are given together. In fact, that's a requirement for licensure, that the one new vaccine that we added 10 years ago isn't disrupting the work of the other vaccines that we've been doing for years before that. Secondly, our studies show that when parents try to spread them out, we know they're putting their baby at risk for those vaccine-preventable illnesses while they're waiting to get their child vaccinated. Those vaccines aren't being given years before the child needs them. Those vaccines are being given now because your child's at risk now. And putting off vaccinating actually leaves your child at risk to get that infection. So you're putting your child at risk. There's a third consideration I want every parent to know, and that is, our studies show that there is no such thing as vaccine immune system overload. In fact, the big immune exposures to children happen with their first feedings. They see far more immune active agents when they get their first meal than they do when they get their vaccines. Those delays actually probably expose the baby to more pain. Every time that baby has to come back for a visit and sees that exam table, our nurses report, and studies have shown that's actually stress-invoking or provoking for the child, and causes more anxiety and pain and discomfort than getting them all at once. It's not doing your child any favor, and it's not doing your provider or nurse any favor either.